Why might I see blood in urine after a bladder biopsy? If you notice blood in your urine after a bladder biopsy, it might seem alarming, but it is often a normal part of the healing process. A bladder biopsy involves taking small tissue samples from the lining of the bladder to help diagnose conditions like bladder cancer. This procedure is usually done with a special instrument called a cystoscope, which is a thin tube inserted through the urethra into the bladder. The doctor can see inside your bladder and remove tiny pieces of tissue for testing. Because this process involves removing tissue, some bleeding is expected and usually temporary. The main reason you might see blood after a biopsy is tissue trauma. When the doctor removes tissue from the bladder wall, it creates small wounds that can bleed. This bleeding is typically mild and tends to resolve on its own within a few days or up to several weeks, depending on how extensive the biopsy was and how your body heals. Another factor is scab formation. After the tissue is removed, small scabs can form at the biopsy sites inside the bladder. As these scabs naturally fall off during healing, they can cause intermittent bleeding, which might make your urine appear blood-tinged for a few weeks. Blood clots can also develop in the bladder because of bleeding from the biopsy sites. These clots can sometimes be passed in the urine and might cause temporary discomfort or even blockages, which is why drinking plenty of fluids is often recommended to help flush out the bladder and prevent clots from forming. Inflammation and irritation are also common after a bladder biopsy. The procedure can temporarily inflame the bladder lining, leading to symptoms like painful urination, increased frequency, urgency, and continued blood in the urine. Sometimes, a Foley catheter is placed after the procedure to help drain the bladder and prevent blood clots from causing blockages. This catheter and any irrigation system used help manage bleeding and keep the bladder clear during healing. While some blood in the urine after a biopsy is normal, it is important to watch for signs that may require medical attention. If bleeding becomes heavy or does not decrease over time, or if you have difficulty urinating despite feeling the urge, you should contact your healthcare provider. Also, if you develop pain, chills, fever, or notice a significant decrease in urine output, these could be signs of infection or other complications that need prompt evaluation. In summary, seeing blood in your urine after a bladder biopsy is usually part of the natural healing process caused by tissue removal and minor trauma. It often resolves within days to a few weeks with proper hydration and care. However, persistent or heavy bleeding or other concerning symptoms should be evaluated by a healthcare professional to ensure there are no complications. Remember, bladder biopsies are important tools for diagnosing bladder conditions, and understanding the healing process can help you feel more comfortable during recovery. Always follow your doctor's advice and report any unusual symptoms to ensure your safety and health.